Hi, everyone. My name is Giza Lopez, and I am the Executive Director of the New York State Youth Justice Institute. Let me start today by giving thanks to all of our partners in New York State, and especially the Division of Criminal Justice Services and the University at Albany. Without their institutional support, we would not be here. Before we introduce our wonderful speaker, and our fantastic moderator for today, both of whom have put a lot of love in the chat here that you may or may not be seeing, I want to pause for a brief moment. I want to use this stage just for a bit to gush a little about our wonderful YJI team. I have a special shout out to Amy Secor and all of the TTA team behind the scenes who have brought today's webinar to you. This month, we're celebrating the 5th anniversary of this series. Since we started right at the beginning of the pandemic, we have hosted nearly 50 webinars, and more than 12,500 people, like all of you here today, have joined us from close and from far for these trainings. We're grateful to you for your support, for you showing up, and for the community you've created here with us. Earlier this week, we lost one of our greatest fans, Grandma Marge, a pioneer in health justice who joined us for many of these webinars. She is tuning in from a better place, I am sure, and she has left us with the incredible legacy channeled by our own Alicia May, her granddaughter, and one of our Lunch and Learn stars. It is now my pleasure to welcome today's speaker, Dr. Shabnam Javdani. She is Associate Professor of Applied Psychology at NYU and a stellar researcher. I'm one of her greatest fans. Her full bio and incredible achievements are being added to chat right now. Shabnam, it is such a pleasure to have you here. It is also my utmost pleasure to welcome and introduce our guest moderator, Janille Hill. Ms. Hill is a facilitator, spiritual director, and connection coach based in New York City. She holds advanced degrees in psychological counseling from Columbia University, and she is a founder of Street Connect. If you're intrigued, ask her about it. Now, her bio is being dropped in chat. I want to end by encouraging everyone here to drop your questions into the Q&A, not chat, throughout the presentation for the conversation portion of our webinar. But until we get to that, Shabnam, the virtual floor is all yours. Thank you.
Thank you so much, Dr. Lopez, and to the New York State Youth Justice Institute. Happy 5th anniversary. It is a pleasure to be here with you all today to talk with you all a little bit about gender responsive programming and care. Okay, fantastic. So I've prepared some slides for our conversation today, and I will be asking a few polling questions as we go along the presentation. But my focus today is, as you can see from the title, talking about a program that I developed and have been researching and implementing in a variety of different jurisdictions called ROSES. And so the title of my talk is Roses from Concrete, Community-Based Advocacy as Gender Responsive Care. The name of this talk, the name of the program and the name of this talk is inspired from the poem by Tupac Shakur, Roses from Concrete, which you can see populating this silhouette of a flower that was created by one of our advocates in the program. And the program itself was named by one of our participants early on in the pilot implementation of this program around the year 2006, 2007 in the Chicago area. With that anecdote share, I just want to share also a little bit of a brief background and history of Roses and a note on the use of the term girl. So when I'm speaking today about some of the research and the intervention science that comprises the work that I will present today, I'm going to use the term girls, and that term encompasses many multiple gender identities. But I use it to refer to young people who are processed on the female side of the juvenile legal and child welfare system, recognizing the myriad of gender identities that processing may encompass. So onto a little bit of background. And as I see folks in the chat and attendees coming in, I want to say hello to new friends and also old friends who I have connected with in various different spaces nationally and in New York State. Thank you so much for attending. It's so wonderful to see your names in the audience today. I really appreciate everyone who engages so meaningfully in the work of youth care in general and gender responsive care in particular. And that care and that motivation and hope for doing better for our children is really what brought me to this work as a PhD student in clinical and community psychology about 15 or so years ago. And while I was in graduate school at the University of Illinois, and I came there by way of Oakland, by way of Los Angeles, by way of Tehran, Iran, and many other places in between. When I came to graduate school, I was really interested in understanding how to support the self-determined goals and dreams of young people who found themselves at the margins of systems and society. And what I realized relatively quickly was that there were few options and few programs for young people who were impacted by systems in general, and especially if you identified as a girl or a gender expansive young person, there was very little for you in the way of programs. And many stakeholders and service providers who I interviewed along the way seemed to indicate that there was a sense in the juvenile legal and child welfare system that if we had girls in our spaces, we simply painted the walls pink and called it a gender responsive program. And we know that that is a superficial and potentially harmful way of approaching programming, policy, and practice support for young people who may find themselves in a moment of incredible precarity when they make contact with us through the child welfare and the juvenile legal system. And so that was a bit of the inspiration for designing Roses, which I will talk with you more about today. Here is a little bit more in terms of background and for what we know about why we need gender responsive care. And here are some national statistics that I use to justify some of my work and that I find incredibly compelling. The United States incarcerates more girls than any other country in the world, full stop. Between 1980 and 2021, the number of incarcerated women increased by more than 525% in the United States. We know that girls in the juvenile legal system are the same population as women in the criminal justice system. On a typical day, 15% of youth in residential placement are girls, and girls' arrests have risen for the first time since 1990, with girls accounting for 31% of all arrested youth compared to about 18% in 1990. So about 1 in 3 young people who are in the juvenile legal system are girls. We saw that number dip around 2020 when this wonderful series began, and we're seeing that number spike again since about 2022 or 2023. Here's some more data for us to consider, because I hear from many folks that, yes, it's important to focus on girls, but most of the young people that we see in the legal system are boys. And that is true in terms of sheer frequency. If you look at the graph on your left-hand side, you'll see the number of arrests involving young people from 1980 to 2020, and you see that that trend is on the decline. What you don't see, if you don't disaggregate by girls, is the graph on your right, which is that girls comprise a growing proportion of all teen arrests during approximately that same period. So even though arrests for young people might be decreasing, girls' share of those arrests are increasing and have been steadily increasing since the 1990s. In fact, starting in 2019, the number of girls arrests nationally rose for the first time in 30 years. We also know that girls are more likely to be arrested and detained for lower level offenses. Nationally, girls account for about 1 in 3 youth placed in juvenile facilities for things like skipping school, violating a curfew, violating a term of their probation, and other low-level offenses. We know this working in New York State, as they encompass the umbrella of PINs, or persons in need of supervision. And girls account for more than half of youth incarcerated for being a runaway. One of the pieces of evidence that we found in a study focusing on New York City and Westchester County really leaves me, really I find compelling, and that is that we can cut girls' detention placements in half by finding community-based solutions that work for girls' lives. And this is in no small part due to the fact that girls are detained for lower level offenses. So I want to pause here for a moment and ask you all just to reflect on this poll question and answer which of the following statements do you think is true. People who work with system-impacted girls are motivated and dedicated to their work, usually prefer to work with boys, experience higher levels of burnout, find creative ways of meeting girls' needs, or all of the above. And as I see your responses coming in, I can clearly see a pattern forming where so many people are indicating an all of the above kind of answer. And a not so close second is the experience of higher levels of burnout. And I'm so glad that we seem to be on similar pages when it comes to this question, because the truth is that this question puts forward a paradox, a set of paradoxes for us, which is that the folks working with girls and gender expansive kids are incredibly motivated. They are finding exceptionally creative ways of trying to experience their needs. And more often than not, if given a choice, they prefer to work with boys. And a big part of that is because they experience higher levels of burnout because they feel like there is not very much they can do to support the real needs of the girls that they're working with. So all of the above is absolutely the pattern that the research findings would also suggest. And so why is this? Well, of course, it's all of the above. When we look at who the population of girls is that we're working with, the girls are involved with systems, girls involved with the system, involvement in the system is driven by marginalization, trauma, and abuse. You can see some of the statistics here taken nationally show that more than 60% are Black, Latina, Native, Asian Pacific Islander, 40+% identify as LGBTQ, transgender, nonconforming kids, more than 90% live in segregated poverty, experience housing precarity, and as we very well know from any of our work that intersects with girls, more than 75% experience mental health and trauma when they are referred to us or when they come in contact with us at any moment in time in the system. Girls also report a multitude of overlapping unmet needs. This is from our own research from the ROSES program. As you can see, the chart on the right basically shows a bunch of different lines and a bunch of different need areas. And what that tells us is that at any given moment, when you ask girls about the needs that they have, they report many overlapping such needs, including around their own safety, around needing to navigate the legal system, education and school push-out, including suspensions, expulsions, and other forms of exclusionary school discipline. 70% or more are indicating a need for immediate economic resources, such as being able to have transportation money to take the train or the subway. And 40% report an imminent risk of losing housing, and that includes, of course, the housing that they share with family and siblings. So, of course, folks working with girls in these situations are have a difficult time trying to meet girls these many areas of unmet need. And the reality is that when girls come into contact with the system, they are coming with all of these overlapping needs. So a natural question in my area of research is, well, what services and programs do we have for girls? What supports are there to meet these unmet needs and to respond to the economic and housing precarities and the racial and ethnic disparities that I just showed you? Well, here's what we know in a nutshell. About 1 in 3 youth in the juvenile legal system are girls. About 1 in 2 in the child welfare system are girls. But about 1 in 20 programs are designed with girls in mind. And that is a pretty liberal estimate. That number could easily be 1 in 50, depending on how we code those data, but trying to be as inclusive as possible. About 1 in 20 programs that exist with any kind of data on them are designed with girls in mind. And so let me ask another poll, given this information. I would love to know your thoughts on this question. Experimentally evaluated programs considered the gold standard for system-impacted kids in general, think MST, FFT, etc. Are these programs just as effective for girls? True or false? Thank you so much for taking the time to respond. And it looks like a majority of folks, about 3 out of 4, are indicating false. And that is correct. So it is not true that experimentally evaluated programs are just as effective for girls as they are for boys or kids in general. In fact, we did a series of studies looking at every single program with published experimental or quasi-experimental results, and I'm going to share the results of that with you in just a moment. So please know that I am more than happy to make my slides available to you all at the end of the presentation, so I'm going to synthesize up in this moment. But we did a meta-analytic study, which basically takes thousands of empirical articles that we search for in many databases, and we identify a total number of programs that meet our eligibility criteria. Basically here, our eligibility criteria are, is this a program for juvenile legal or child welfare impacted kids? And if so, do they report outcomes for both boys and girls? We found 35 such programs with 56 different comparisons within. And overall, we found that programs are moderately effective for girls. However, these programs are significantly more effective for boys. When we look at all experimentally evaluated programs, they are more effective for boys, but they are somewhat effective for girls as well. And thank you, Chloe. The age range in this sample is approximately 11 to 18, with the median age being about 14 or 15 years of age. Okay, so still effective for girls, but not as effective as these programs are for boys. Now, let me ask you another question. The most typical types of programs offered to system-impacted girls include which of the following? And I believe you can select multiple in this case. What do you think are the most typical types of programs offered to girls? So what modalities? These are all relatively typical, as your responses are indicating, with group-based and individual counseling competing for the win, followed by family therapy and mentorship. Fantastic. Yes, you are right. You are correct. Group-based programs and individual counseling, if that counseling is primarily casework, are the most typical types of programs offered to girls, okay? And so I'm going to come back to this in just a moment because it has implications for our understanding of effect sizes. So, as I mentioned to you from the previous meta-analysis study looking at those 2,000 or so programs, we found that programs are effective for girls, but not as effective as they are for boys. When we drill down further, we see that girl-specific programs, programs designed for girls, demonstrate the largest positive impact. That's the white box to your left. Girl-specific programs demonstrate going to your box all the way on the right, gender neutral programs, on the other hand, demonstrate the most negative impact for girls and the most positive impact for boys. So when we distill those experimentally evaluated programs and say, okay, were any of them designed with girls in mind? If the answer is yes, those programs have a significantly positive effect for girls. But when those programs were not designed with gender specificity in mind, those programs can actually have a negative effect for girls, meaning involvement in those programs, for instance, can be related to arrest, technical violation of probation, for instance, and recidivism. And what those types of programs typically involve are the group-based and individual casework models. And so this next poll here is asking you, what do you think are the least effective types of programs for system-impacted girls? We talked about what's typical, what's most, what is least effective based on the programs that have been evaluated so far. Another way to ask this question is, what kinds of programs do we think are not designed with girls in mind and might not be very effective? And here, please select the one that you believe is the least effective for girls. Okay, that's right. Group-based programs followed by family therapy are the most popular for girls and the least effective for girls. These are the types of programs that girls are likely to be mandated to complete either as part of diversion, probation, or beyond. And these programs can result in higher levels of recidivism and worse mental health outcomes for girls. So going back to that question about practitioners and folks working with and on behalf of girls experiencing burnout, here are another set of reasons looking at the programming landscape for why that might be happening. So what are the features of effective programs based on the programs that we reviewed? We looked at the content of these programs and we saw that they include key features that go into actually making up the design of the ROSES program in particular. And you can see them listed here. These are likely no surprise to you: youth-centered, strengths-based, community-based, connecting girls with resources, paying attention to those multitude of needs, reducing the chance that girls are rearrested for things like technical violations, and working directly to reduce truancy and running away by trying to understand why truancy is happening, why running away is happening, and trying to address the environment and the context surrounding the behavior, as opposed to just trying to reduce the behavior in and of itself. The key to ROSES, as I will mention next, and in the final part of this presentation, is that we combine all of these different features into the same intervention model and take the word community-based and really, really mean it. That means that we go to young people where they are at, and we do so through a series of weekly meetings that are determined by the schedules of the young people and their families. So let me tell you a little bit more about the ROSES model. And let me say up front about the research that has gone into what I'm about to share with you here. And the full research article is available at the very end, at the link at the very end of this presentation. But what I want to highlight here is that we conducted a randomized controlled trial, an experimental study, where we received 400 or so referrals 253 youth and parents were eligible, and then we randomly assigned girls to work with the Roses team or to receive any and all services as usual in New York City, which are plentiful. There are more services available to youth in New York City than potentially many other jurisdictions and regions. And so those girls assigned to the control condition received many services over the course of the experimental evaluation. And what we wanted to ask is working with a Roses advocate related to any positive outcomes or the reduction of any negative outcomes. And the advocacy framework broadly takes the medical model framework, which you see on your right, and sort of flips it on its head. So you can imagine the feeling that you have when you go to a doctor or a dentist that focuses on the concept of sort of disease or pathology, seeks a diagnosis, wants to reduce symptoms. The doctor is seen as the expert. The patient's compliance is under question, and the problem is located in the person. In much of social services, we have generalized this medical model to our program designs. Roses intentionally backs away from that and takes on an advocacy framework where we center the concept of resource distribution and opportunity structures. We center the rights of young people. We think about strength enhancement with the advocate as the collaborator and the client as the expert in their own lives. And we intentionally work each and every day to locate the problem in the context surrounding girls as opposed to in the girl herself. So our motto is change the context, not the girl. And that is a touchstone we come back to every single week when we supervise our advocates during every single intervention week that they work with girls. And they work with girls through a series of 4 different phases of advocacy that are overlapping and that continue for the duration of the program, guided by our strengths-driven strengths-based, youth-driven, and community-centered touchstones, where advocates are engaging in the assessment of needs and rights, are mobilizing resources, and here is oftentimes where casework ends and advocacy begins, monitoring whether or not the resources that were developed, that were found, are actually working, and if not, mobilizing additional or different resources, and along the whole process, working to support girls in advocating for themselves through a process called self-advocacy. So as I mentioned, our advocates go to girls in their communities, prioritize listening and engagement, and identify opportunities for girls' self-determination. And some key components of the program that I will name and then end with our final punchline of findings is that our advocates are paraprofessionals. They are university students. They have been volunteers at nonprofit organizations and other train the trainers that we have done. And they have been peer advocates in various youth organizations. They are highly trained in a 40-hour intervention training, and they are highly supervised to work one-on-one with young people. So let me pause and just underscore something exceptionally unique about this model that uses paraprofessionals, which is that our advocates have a caseload of 1. That is unheard of, and we know that, and we work to try and figure out what other settings and contexts can potentially have caseloads of 1-to-1 so that advocates can deliver 10 hours of community-based intervention for 12 intervention weeks. And that can span anywhere from 4 to 9 months because of the way that we count intervention weeks. And I'm happy to go into that for anyone who might have some questions there. Just want to let you know who the girls were who were in this study. They were primarily Black and Hispanic or Latina. As you can see, the distribution here is that they are primarily in the 9th and 10th grade. They are majority receiving an income of under $30,000, and that's their family income. And they are They mostly have partial high school or are working on graduating in high school. So this is the same group of young people who are system impacted and involved in the child welfare system. And so my last question for you all, which leads us to the punchline, is a question for your consideration. Programs that only focus on changing the girls' environments and not asking the girls themselves to change end up leaving girls' emotional scars unhealed. Just made a quick case that in Roses, we change the context and we do not ask girls to change. Girls can tell us, I want to drop out of school. And we say, okay, tell me more about that, instead of, whoa, 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 that sounds like a really big leap forward. Does this model, right, and this approach of not asking girls to change end up leaving girls' emotional scars unhealed? And I see some mix here. About a third of folks say, no, it doesn't leave emotional scars unhealed. And many folks say, yes, asking the context to change, but not the girl, may leave their emotional scars unhealed. And I get that mix. And I understand that, because we know that there are many emotional scars from the data I just presented that are in fact present and may need to be healed. Well, when we did this study with our, almost 300 young people, we found that compared to those 35 other programs that focused on changing girls individually, Roses had the largest single effect in reducing anger-related mental health issues. Roses kids were 12 and a half times less likely to be in a physical fight over time as we studied them over months and years. And they were 3 times less likely to report a status offense or a PINS offense or engage in delinquency. I present these behavioral change indicators to say, when we don't ask girls to change, they may change anyway. And in this last slide, they may also heal. Here are the strengths that were significantly increased in Roses kids as opposed to control kids: resilience, self-efficacy, happiness, goal orientation. And the symptoms that were significantly reduced in Roses kids compared to control kids who were just randomly assigned to Roses versus control: violence, delinquency, depression, and substance use. And the effect sizes for those symptom reduction indicators are particularly large, as you see on the bottom right-hand side of your screen there. And so I will end by saying, because of these results, Roses is considered a model program in the Office of Juvenile Justice and Delinquency Prevention's guide and in Crime Solutions. I am more than happy to answer questions at this time, and to also end by saying your work with girls matters, and it matters tremendously. So these are the references and the link that you can go to for all of the references, and thank you so, so much.
Wow. That was amazing. I feel like as I listened to you, my heart was just open with the consideration of how we can do work and see girls for who they are rather than the circumstances that have placed them maybe in justice involved situations. It's very thoughtful research, and the presentation of it was lovely. There are several questions from the audience, so I'm going to jump right in with them.
Fantastic.
Based on your research, what are the top 3 ways we can promote contextual competence in our daily work with young girls or young women involved in the justice system?
That is a wonderful question. I'm so delighted that we're starting with an applied question that asks ourselves how we can support girls by changing their contexts, which is part of what I read in that question. I think the first way is the simplest solution that oftentimes we overlook because we are seeking some complex program design elements, and that is effective listening. Our advocates receive hours of training on the basics of effective listening. We're talking about psychology, Carl Rogers, the humanization of folks through listening, and they receive training on effective listening. And that goes an incredibly long way to understand girls' needs in general. The second is to understand that the system's response to girls matters in terms of the behaviors that girls are engaging in. So for instance, if we are mandating family therapy for a girl who keeps leaving her home, that is likely not going to work. And we have to understand that the power dynamic, even within the girl's family, is such that she will have the lowest relative form of power. And so she will be the one who fails up and out of diversion if that's a diversion program, or doesn't meet that term of probation if that's a term of probation. So understanding the response of the system and not assuming that the system offers everything we need it to. And then the third thing I would say relates to program accountability and how we as programs show up for young people and for girls. And one of the recommendations that we make to other programs and that we certainly adhere to in Roses is that we need to, as a program, as providers, increase and up our capacity for tolerating distress and tolerating uncertainty, because this will take time. And we do not want our distress and our uncertainty to lead to impulsive choices that we make as a program that have big consequences for young people.
Which is incredibly difficult, right? It's that self-check for ourselves, as well as what we're doing programmatically. And to that idea, are there specific laws, procedures, or practices in the justice system that may affect girls more negatively than how they affect young boys? I know you spoke to this a little bit, but can you speak a little bit more on this?
Absolutely. Are there specific laws? Yes, there are many of them. I want to point to two that I think are particularly timely right now, and they're around a series of legislation and policies. The first has to do with school push out and exclusionary discipline. As we know, schools are policed, and the schools that have kids living in poverty and Black and brown kids and immigrant kids are policed more so than other schools. The presence of school police has more significant consequences for girls than boys. And when you look within Black children in particular, the rates of suspension and expulsion, given the presence of school police, are impacting Black girls even more so than they are impacting Black boys. And a big part of that has to do with the fact that on school property, subjectively determined behaviors like dress code violations can get young people in trouble with the police. And those are going to affect girls in particular ways, especially around the sort of morals of disrespect and attitude and things of that nature. That has big consequences for girls' life success in general. So that's one set of policies, is our school policing policies and what happens when there is a suspension or an expulsion. The second law I want to point to, it has to do with residential treatment facilities or residential treatment centers. These are relatively newer types of settings, and they're more popular than they ever have been. And they come from well-intended, well-meaning laws that said, hey, we cannot place kids in secure confinement if they just have a PINS or a status offense. That did reduce the number of girls in secure confinement and in detention and placement and so on. But what it also did was create residential treatment facilities that girls now are housed in at very high rates. And one aspect that I will point out about residential treatment facilities is that kids can be arrested on site at residential treatment facilities, and girls are extremely highly likely to receive their very first arrest and their very first delinquency charge when they are staying at a residential treatment facility. And there is no mandate for treatment at a residential treatment facility by law.
That's disheartening. A lot of the questions in the chat are asking, how do I bring this to like my situation? And how do we get like these kind of trainings on effective listening? Do you have any suggestions for that?
Absolutely. So New York City, email us. I just put that email in the chat. We are actively accepting referrals. Sometimes we navigate wait lists, of course, but we have been in New York City for almost a decade, and we have a set of incredible partners here. What about upstate girls, Anne? I'm so glad you asked, because we are working on that too. We are right now working with the unified court system to develop a train the trainer model and a sort of readiness toolkit to be able to bring roses to providers, for girls and for organizations that are upstate or that are sort of outside of New York City. Right now, we're doing that in Westchester County, but we're really excited and eager to develop a toolkit, and that will come with an asynchronous training that can be accessed free of charge, that might not involve, the travel and the sort of initial set of resources that it might take to sort of launch a new program within your organization. So absolutely more to come on that. We expect to have those materials available around late 2025.
Sweet. There's hope for all of us. The advocacy training in this program looks extensive, and as you just spoke to as well, are advocates like compensated or paid for their roles, or is it all voluntary?
Yeah, that's a great question. So we have basically two types of programs that we do in Roses. The first is university-based programs, and a part of where advocates are enrolled students at universities, advanced undergraduate students, or graduate students at universities. We've done this at the University of Illinois. We've done this at Rutgers. We've done this, of course, at New York University. And that model of programming comes from the hope, the goal, and the dream and the assumption that universities must play a role in supporting communities. When we enroll our young people in Roses, they are New York City born and raised. More than 90% of them have never set foot on NYU's campus. That is not okay. And so for universities to be able to share resources in the form of students who are extremely eager and excited to support in this way is really important to us from a values-based, perspective. And what those advocates receive are course credits, internship credits, a whole lot of letters of recommendation, and of course, community and training that can help those advocates open up doors for their own career pathways. When we have done Roses in other non-university based models, we have typically come up with a way of sharing internship credit through NYU or other universities. And when those advocates have been system impacted, sort of older siblings used broadly speaking, we have worked really hard to provide stipends for that work, because it is not going toward a particular sort of 4-year degree necessarily. So those are the different ways that we've done it.
Sweet. I'm just like, oof. Can you provide a specific example of how this work is done, exactly anonymously, of course, but like the problems that have shown up in the girls' lives and the solutions that were implemented? And kind of tied to that question, In the Roses program, do you view advocacy and mentorship as the same thing? Or can you talk about the nuances through this lens?
Yeah, absolutely. Absolutely. I'll start with the second question around advocacy compared to mentorship. So mentorship models can be absolutely fantastic, and they are variable. There are very different kinds of mentorship models. In Roses, we often refer young people who would like a mentor to the many wonderful mentorship programs that exist. But here's where advocacy and mentorship sort of part ways. The first is that mentorship comes from a long line of programs that have the theoretical assumption that when you are with a mentor who you look up to, who you want to be like, that sort of, you absorb that a little bit by osmosis, and you have the role model version of sort of coming of age and doing better and doing right by your mentor. That might be an exceptional fit for some young people, and that is why we refer some kids in Roses to specifically mentorship programs. But advocacy locates the expertise in the client, and the advocate is not a role model for anything. The advocate is, but except for doing what they said they were going to do, meaning an accountability role model to the young person. That if the young person says, I would really, really like to learn a little bit more about like whether I should get my GED or should I try to finish high school because I really don't like going to this school. The advocate needs to come back with that information and remind that young person, this was a goal that you had. Is this still a goal that you have, right? So that accountability of keeping track of some of those goals and bringing back information they promised that they were going to bring back. Then the advocate's role is to think about structural change, that motto of change the context, not the girl, without saying to that young person, you know what? I decided to go to college and I decided to go to NYU.
Yeah.
It's been great for me. Let's try to do the same for you, right? That's a little bit more along the lines of the vibes of mentorship, although again, not all programs. Yeah, exactly. The vibes. Let me give an example, as you asked, Janille, about sort of what might happen, right, for a young person who's in Roses. This is not based on one young person in particular, but sort of a composite of many different cases. Let's say we have a girl who has failed the typical diversion programming that is offered by ACS here in New York City, and is on probation and is actively involved in family court, right? We get many referrals from judges. We might very well get a referral from the law department or from legal aid. And we accept that referral and we begin to work with that young person to see and understand what isn't working about their home life, their school life. What are their hopes and dreams? What are their goals? And in doing so, really privilege and prioritize where we can implement joy, where young people are already finding their joy and their hope, and to just shed light upon that, and to trouble assumptions that might be being made about those young people that would have, especially that would have high legal consequences for them. So in this particular case, I'm thinking of a young person who failed out of a family therapy program and had stopped going to school, was at high risk for being detained or being confined because of this series of patterns that were going on. What we found out in working with this young person was that they were not going to school because they were making the assessment that if they went to school, they might be highly likely to get into a physical fight because of a history that they had with other young people at that school, even though they felt like they had tried many different strategies to avoid fighting at school.
Yeah.
And they were and as they stopped going to school, their relationship with their mother and their older siblings became more and more contentious. And they found that it was just really difficult to be able to say their piece during some of the family meetings, because the goal of those meetings was compliance. The goal of those meetings was to say, all right, So you're going to go to school this week, right? Next week came back, went to school, 3 out of 5 days. That's not good enough. So you're going to go to school this week, right? And so Rose's advocates come in and they try to understand the underlying pattern. And they say, hey, can we pause family therapy just for a little while? Because it looks like the primary issue with not going to school is that this young person actually doesn't feel safe at this school. How can we support a transfer? And how can we think through ways that where the young person can still submit their homework? And we may go around with the young person and meet with every single teacher to say, listen, this young person doesn't feel safe coming to school, but she's down to do your homework. Can we get a Google Classroom going? What can we do for the next 2 to 3 weeks while we wait and see if a transfer is even possible? And then we take that information and we try to disseminate it to all the different providers. Why? Because we have a caseload of 1 and we can do that 10 hours a week. Yes. For one young person gets you a long way in understanding the context and gets you a long way in making it so that that young person isn't punished and doesn't graduate up into the system, into deeper levels of the system because they didn't feel safe going to school and because they didn't know how to express that effectively to their family in that format and at that time.
It sounds like you guys are spiraling down into their inward life as well as making those changes contextually with that information that you're gathering, which is chef's kiss. Do you guys provide updates to the referring agency, and how is success measured?
Yes, that's a wonderful question. I was also just looking at that question too, because it's really important for us to provide updates to the referring agency, especially when our young people are actively court involved. We provide updates. We track progress every single week. We supervise our advocates in person for 2 hours every single week and provide our advocates with a written set of feedback for their goals for that week. And then we write letters of progress at any time we're asked to from the referring agency and or have case conference meetings at any time.
There's part of me that wants to just keep asking you questions and digging deeper into the research and work. But our hour is coming to a close and it feels like it came so quickly. Um, Are there any final thoughts, charges, reflections that you want to leave with us today?
Oh, I have really, really enjoyed and loved the questions and the opportunity to be able to reflect on some of the broader sort of touchstones of the program. I think the final thought that I would leave with us, which is something that I have reflected on with colleagues and collaborators over the years, and that is that oftentimes our girls end up in systems confined with restricted liberties and have a reduced childhood, especially given forces like adultification bias that see girls and Black and brown girls in particular as older than they actually are and hold them accountable for an older body and mind than they actually have. I've been left with the thought that so often we take more extreme measures for girls' own safety and protection. And that is counterintuitive to the idea that we believe we are protecting public safety, although I know that's a little bit more in the criminal legal system, but that kind of mentality, that kind of thinking that, well, we have to do something because if we don't, ... some kind of a risk to public safety is posed, right? When we have done interview studies with stakeholders, judges, lawyers, practitioners, caseworkers, social workers, probation officers, you name it, the main thing that folks say is that we took this more serious action of confinement, of higher level probation, of a technical violation, of a new charge, et cetera, for her own safety, because we didn't want her to be out in the street, because we didn't know if she was, if this and that would happen. And that is an incredibly consequential thing to do. And we might want to do some reflection about if and when it is okay to restrict the liberties of children under the guise of their own protection, not of the public's safety and protection.
That's it. It's like a mic drop. I'm going to turn it over in a second. And then there are also a lot of questions. People are itching to get more information about the Roses program and how to get children, girls that they're involved with enrolled. So I don't know if you want to quickly say something about that, but I'm also turning it over.
Absolutely. The slides will be shared. There's a slide at the end with the Roses email for anyone interested in Roses referrals or Roses more broadly. Please feel free to email us. That will come directly to me and our whole amazing Roses team. Thank you so much.
Thank you. I'd like to thank you both, Dr. Javdani and our guest moderator, Janille Hill, on behalf of the YJI and everyone in attendance today for taking the time to share this incredibly great presentation and information with all of us. So thank you both. In a moment, we are going to launch a poll. It's a closing poll and questions asking how much you agree or disagree with the statements. The webinar was informative and the webinar was engaging. Please answer the questions so that we know how today's webinar went for all of you. While everyone is answering that question, I have a few announcements and items to put in on everybody's radar. For our next Lunch and Learn on April 29th at 12 p.m., Dr. Gina McGovern, Cortez Watson Jr., and Micaiah Jones will be giving us a presentation titled Navigating to Justice, How Youth Programs Support the Positive Development of Black Youth. More information to come, and the registration will be in the chat. Immediately following this webinar, a survey should appear in the browser window you used to join today's webinar. Please complete the survey as it allows you to provide further feedback and questions for us. Then this information is also used to improve future webinar sessions. The survey should take no longer than 5 minutes, and we will also put the link for the survey in the chat now. Finally, if you have not already done so, feel free to connect with us on Facebook, Instagram, and LinkedIn. The links to those accounts can be found on our website. Just a reminder that the views expressed here are those of the presenter and do not necessarily reflect the views of the New York State Youth Justice Institute. In closing, I want to thank you all for taking part in this session of the YJI Lunch and Learn series. We hope that you've gained something from this webinar and that you continue to think about what Dr. Javdani presented today. We look forward to seeing you at future YJI events.